In the Larco Museum in Peru, and deep within museum archives across the world, lie human skulls with perfectly cut holes. We are talking about trepanation, the oldest surgical procedure known to humanity. But here is where the comfortable myth of modern superiority ends, and an unsettling historical reality begins.
Steady, man. We must work quickly.
A popular internet rumor claims these Peruvian skulls are 5,000 years old, and baffled a Harvard neurosurgeon named John Wager.
In the heart of the Andes, the surgeon
As with
prepares for one of
most
the ancient
internet
world's most
lore,
perilous
the
procedures,
names are
trepanation.
fabricated, and the dates are slightly blurred. But the actual, verifiable facts are much more intimidating than the fiction. The truth is this. Dr. David Kushner, a neurologist at the University of Miami Miller School of Medicine, conducted an exhaustive study on over 800 of these trepanned skulls from the Inca Empire and its predecessors, dating back over 2,000 years. His conclusion wasn't just a polite nod to ancient medicine. It was a devastating comparison to modern history. Doctor, Kushner found that the survival rate for Inca skull surgeries reached a staggering 80 to 90%. To put that into perspective, the mortality rate for skull surgeries during the American Civil War, centuries later, was nearly 50%. How did ancient practitioners, operating without modern anesthesia, antibiotics, or sterilized steel, achieve cleaner outcomes than 19th century Western doctors? They didn't just drill holes. They engineered highly specialized operations. Today, we are opening the case files on 6 distinct ancient brain surgeries, 6 specific operations from around the globe that challenge everything we assume about the linear progress of medicine. Every case is documented, every skull exists, and every technique raises questions that modern neurosurgeons are still analyzing. The Inca scraping technique, Peru. Let's start with the very skulls Dr. Kushner examined. In the southern highlands of the Andes, the Inca surgeons, known as Hampi Camayok, developed a surgical method that entirely bypassed the fatal mistakes made by European doctors millennia later. When a warrior suffered a depressed skull fracture from a blunt force weapon like a sling stone, the Inca surgeon did not use a heavy drill that could accidentally plunge into the brain tissue. Instead, they used a meticulous, time-consuming scraping technique. Using an obsidian or copper blade, they gently scraped away the bone layer by layer, creating a wide, beveled depression that eventually pierced the skull. By scraping instead of drilling, they maintained absolute physical control, ensuring they never punctured the dura mater, the delicate membrane protecting the brain. Puncturing the dura is what causes fatal brain infections. The Incas knew exactly where to stop. The skulls show massive, undeniable bone regrowth around the surgical sites, proving these patients didn't just survive the operating table. They lived for years, sometimes decades afterward. Furthermore, archaeological evidence suggests they used sophisticated botanical knowledge, utilizing coca leaves and chicha, a fermented corn beer, to manage pain and prevent inflammation, essentially functioning as localized anesthetics. The Ensisheim patient, France, 5100 BC. If you want to go back 5,000 years, we must leave Peru and travel to Alsace, France. In a Neolithic burial site near the town of Ensisheim, archaeologists uncovered the oldest, unequivocal evidence of cranial surgery, dating between 5,100 and 4,900 BC. This isn't just a single hole. The Ensisheim skull features a double trepanation. A 50-year-old man underwent 2 distinct operations at different times in his life. The sheer existence of this skull shatters the illusion that early Stone Age humans were incapable of complex medical care. Both holes, one on the frontal bone and one on the parietal, show clear, undeniable signs of complete healing. The surgeon, operating with incredibly sharp but primitive
Hail
flint tools,
Osiris.
managed to
Hail
expose
Anubis.
the brain
May you live
twice
forever.
without
May
causing
you
a
walk in the
fatal
field of
infection.
reeds.
Modern forensic anthropologists note that the angles of the cuts were deliberate, designed to relieve pressure without damaging the underlying tissue. This wasn't a desperate, violent act. It was a calculated, repeatable medical procedure carried out by early agrarian societies. The Cow Village Sinus Drainage, Egypt, 2181 BCE. When we think of ancient Egypt, we think of advanced medicine. Yet, surprisingly, trepanation was incredibly rare in ancient Egyptian civilization. They possessed immense anatomical knowledge from mummification, which perhaps made them acutely aware of the lethal risks of brain surgery. They only opened the skull when absolutely necessary, choosing to avoid the procedure entirely if the risks outweighed the benefits. A remarkable exception was found in a skull excavated from the Cow Village site, dating to the Old Kingdom period around 2181 BCE. Known in medical literature as case QAU-26, this skull features a highly specific, targeted hole in the frontal bone. Radiological analysis reveals that this wasn't for trauma or a religious ritual. The patient suffered from a severe frontal sinus pathology, likely an unbearable buildup of infected fluid inside the sinus cavity. The ancient Egyptian physician performed a therapeutic trepanation directly over the sinus to induce drainage. They identified the exact location of the internal infection and bored a precise hole to relieve the pressure, a localized surgical intervention that directly mirrors modern sinus drainage procedures. And again, the bone shows signs of healing. The patient survived the infection and the surgery. The Pazyryk nomads, Altai Mountains, Siberia, 300 BC. In the freezing expanses of the Altai Mountains, archaeologists unearthed 3 skulls belonging to the Pazyryk nomadic tribe. Dating back roughly 2,300 years, these skulls demonstrate a level of surgical confidence that left modern researchers astounded. According to neurosurgical analysis published by the Russian Academy of Sciences, the ancient Siberian doctors performed these surgeries to remove blood clots resulting from severe head trauma. What fascinates modern neurosurgeons is the methodology. By examining the scrape marks under an electron microscope, scientists could trace the exact sequence of the ancient surgeon's hand movements. The cuts are resolute, exact, and confident. There are no unintentional chips or slips of the blade, errors that are incredibly common when cutting through thick bone. They first removed the surface layer of the bone with a sharp tool, then carefully carved a smaller window to access the brain cavity. The surgeon specifically chose locations on the skull that minimized damage to joints and the most vulnerable blood vessels. One of the male skulls shows extensive bone regeneration, proving the ancient Siberian surgical protocol was not just an anatomical experiment. It was a life-saving, calculated success. The Monte Alban elliptical drilling, Mexico. Moving to Mesoamerica, we find a completely different biomechanical approach. In the ancient Zapotec center of Monte Alban in Mexico, archaeologists found a collection of skulls featuring multiple, deeply cut elliptical holes. Unlike the Incas, who preferred wide scraping, or the Siberians, who carved windows, the surgeons at Monte Alban utilized a drilling or abrasive technique that focused exclusively on the upper parietal bones. A dedicated study of crania from this site revealed that the surgeries were almost always a response to pre-existing cranial trauma. The Zapotec healers weren't releasing demons, they were treating physical impact wounds from warfare. What stands out in the Monte Alban cases is the sheer repetition on a single patient. Some skulls feature multiple elliptical perforations, indicating that the patient was brought into surgery, survived, recovered, and later underwent the procedure again. To drill directly into the parietal bone, a highly sensitive area over the brain's sensory cortex, and keep the patient alive through multiple recoveries requires a deep empirical understanding of post-operative care. It suggests a societal structure that supported medical training, recovery isolation, and long-term nursing. The Hippocratic bow drill protocol, ancient Greece, 400 BC. For our final case, we look not just at a skull, but at the surgical manual itself. In the 5th century BC, the ancient Greek medical text on wounds in the head, attributed to the Hippocratic corpus, laid out a chillingly precise protocol for brain surgery. The Greeks understood that stagnant blood inside the skull from a head wound would putrefy, turn to pus, and cause death. Their solution was immediate, preemptive trepanation to allow the blood to flow out. The Hippocratic physicians used an instrument similar to a modern trephine, but instead of being motorized, it was rotated by a bow and string. The text provides strict, unyielding instructions. The surgeon must proceed with agonizing slowness. They were instructed to frequently stop the drill, remove it, and check the depth with a probe, actively looking out for the dura mater. To ensure the drill didn't suddenly plunge through the inner table of the skull and destroy the brain, the Greeks engineered a drill bit with a collar, a physical stopping mechanism that prevented the blade from going too deep. This mechanical failsafe is the exact same principle used in modern cranial drills today. They designed an instrument that accounted for human error over 2,000 years ago. The verdict on ancient authority. When we look at these 6 distinct cases, from the scraping blades of the Andes to the bow drills of Greece, we are forced to confront an uncomfortable historical truth. The idea that medical history is a straight line, moving from primitive ignorance to modern brilliance, is factually incorrect. When European and American surgeons in the 19th century were operating with unwashed hands, wearing blood-stained aprons as badges of honor, routinely puncturing the dura, and losing over half of their patients to sepsis, the ghosts of the Inca, the Pazyryk, and the Neolithic healers were already millennia ahead. They achieved survival rates that 19th century doctors could only dream of. They did this not through magic, but through meticulous technique, specialized tools, and a profound respect for the fragility of the human brain. They didn't have antibiotics, so they could not afford to make a single mistake. If you were suffering from a skull fracture, the statistics are undeniable. You would have had a vastly better chance of survival lying on a stone table in Peru 2,000 years ago than lying in a hospital bed in London or New York during the 1860s. Would you have trusted an ancient surgeon with your life? Let us know your verdict in the comments. And if you want to see the medical secrets they used to numb the pain, make sure to subscribe. The next case file is already open.